Welcome to the Gold Report, where we inspire you to be 10% more courageous. I'm so glad you're here. Please share and subscribe so you never miss an episode. We have an inspiring guest on today's show after this short break. Do you feel like the healthcare system is failing you? That's because it is, working exactly as intended to prioritize profits, bureaucracy, and big pharma, while leaving you and your family vulnerable when you need care the most. We understand your frustration. You've been asked to trust a system that feels rushed, impersonal, and biased. You deserve better. That's why we created Gold Care. Here, your values matter, your choices matter, and most importantly, you matter. Gold Care is more than a solution. It's a revolution. Trusted by over 10,000 members nationwide, we've built a system that puts your wellness first. With ethical, independent doctors who work for you, not the system, you'll have access to care that's transparent, trustworthy, and aligned with your values. We understand that stepping away from the familiar can feel daunting, but staying in a system that doesn't truly serve you is even harder. That's why Gold Care offers a healthcare alternative designed to work for you. Whether you're ready to step away from the system entirely or prefer to keep your insurance while seeking the transparent care, ethical doctors, and education you deserve, it's time to stop trusting a system that's failed you. Take control of your health with Gold Care. Join today for just $10 a month and become part of the healthcare revolution. Gold Care, built for you, powered by freedom, trusted by thousands. Dr. Paul, as he likes to be called, has been a practicing pediatrician for over 35 years. He opened Integrative Pediatrics in 2008 with a focus on informed consent and empowering parents. Dr. Paul retired from practicing medicine pediatrics and relinquished his license in December 2022. He does not diagnose or treat, but is educating and coaching from a place of love. That key ingredient our children and all of us need. He is the co-author of two important books, The Vaccine Friendly Plan and The Addiction Spectrum, and has published numerous articles. He speaks on medical freedom and the data for vaccinated and unvaccinated children. Dr. Paul is the founder and host of the show, With the Wind, Science Revealed. Dr. Paul has joined forces with Dee Dee Hoover, and they travel the country speaking on health, freedom, communication, and putting kids first. They are developing workshops, putting on conferences, and writing as a team. So I'm delighted to have on the show, as I introduced a moment ago, Dr. Paul Thomas. Welcome, Dr. Paul.
Why, thank you, Dr. Gold. I have watched your involvement with what's happened in our world for the last few years with great interest. Thank you for all you do.
Thank you so much. We decided to do the podcast, The Gold Report, because we want to inspire people to be 10% more courageous in their daily life. People think, you would come up to me, especially in 2020, 2021, I suppose 22, and say, well, I can't do what you do. I'm not a doctor. I'm not a lawyer, all those things. I said, no. You can be a little bit more courageous in your life, in your daily life. And so we love to have people on the show who have demonstrated that ability to either be thinking critically or to speak out. And that's why we're so happy to have you here today. So everybody has already heard that you are a pediatrician, but in fact, you stepped away from what I call the medical industrial complex. I don't know if you have another name for it. That's my preferred name, legacy healthcare. Anyway, medical industrial complex. And you stepped away from that, and you have done and said a lot of things that are in the minority. Although I wonder how many physicians believe these things secretly. So your particular area of expertise is pediatrics, and that makes you even rarer than most doctors. You might not have known I've said that I think doctors actually did worse than average Americans in terms of freedom and fighting for freedom and fighting for ability to think critically. But of doctors, pediatricians were the worst of the worst.
Agreed.
They were the worst of the worst. And people have often asked me, I'm curious your opinion. I think it's multifactorial, but certainly one of the motives is financial. I mean, pediatricians are they're virtually, I think 98% of pediatricians can't survive without following conventional protocols, for example. That's one of the reasons. But anyway, you're a person who thought for yourself. Just kind of wondering if we can just jump right into it, like your thoughts on vaccines, childhood vaccines, COVID vaccine, any place you'd like to start, kind of on the vaccine issue. And then we'll get into something that I'm interested in, hearing your opinion on SIDS, sudden infant death syndrome, and things like that. So wherever you'd like to start, maybe the vaccines.
Sure. Let me put it in perspective, because I was a board certified pediatrician for 30 years. I drank the Kool-Aid. I was supporting initially it was the Academy of Pediatrics, the American Academy of Pediatrics, the AAP, and then in conjunction with the CDC, who took over creating the childhood vaccine schedule. So I witnessed it expanding from a handful of vaccines when I first came out of training to now we're close to 100 if you count COVID and annual flu shots. And my journey changed when I started becoming aware of the fact that kids are not doing well. Chronic disease is just rampant. And we, the pediatricians, who were supposed to be the most knowledgeable people on the planet about childhood health, had no answer for autism, for all the developmental issues, the autoimmune issues, the allergy issues, chronic disease. We just didn't seem to know, except maybe here's a pharmaceutical to treat a symptom. So I got very discouraged with all of that. And then in 2004, 5, 6, and 7, each of those years, I had a patient of my own who was normal at 12 to 18 months who regressed into full nonverbal autism. And I was already in a deep dive of why. Why is this happening? We have to know why if we're going to stop it from continuing to happen. And we'll get into this again with SIDS. It turned out, as I started looking at my own data, initially I published in my book, The Vaccine Friendly Plan, because I was unable to publish in mainstream journals. They wouldn't look at it. So in the Vaccine Friendly Plan published in 2016, I had no ongoing autism in my minimally vaccinated or unvaccinated patients. But the autism rate was 1 in 60 for the highly vaccinated who were following basically the CDC schedule. And I was like, wow, if this is true, this is really important. Vaccines might be a big reason. I've never said it's the only reason, but it might be a big reason for a lot of the harm we're seeing, a lot of the health problems in children. And of course, publishing that book and being outspoken about the possibility that vaccines were an issue brought the attention of the medical board on me. And in 2019, they said, prove that your vaccine-friendly plan is as safe as the CDC schedule. That led me to publish the data for every child born into my practice. And this was 2,700 and some variably vaccinated. None of them were CDC vaccinated, and 563 unvaccinated. So it was one of the largest single practice, probably the largest single practice vax to unvax study. And what we found was absolutely astonishing. Not to me, because I was with this, these were my patients. I knew what I was seeing. What I was seeing was unvaccinated patients were extremely healthy, but I didn't have the data to say, look at it. So we published in the International Journal of Public Health, the Vaxxed study that I think was just like, wow. We were seeing 4, maybe sometimes 5 times, 400 to 500% more autoimmune conditions, allergy, asthma, eczema, and then the neurodevelopmental issues, ADD, ADHD, learning disabilities, language disorders, autism. The numbers weren't high enough to have a massive significance, but it showed a signal for autism as well. And then here's the really surprising one, I think, for most doctors and maybe even for families that are listening. The highly vaccinated had way more infections. So, you know, Simone, as doctors, we were told to vaccinate to prevent infection, right? To keep our kids safe. Turns out the highly vaccinated were getting way more ear infections, lung infections, skin infections, GI infections, all infections combined to the tune of 2 to 5 times as many. So I always like to clarify for folks who are thinking this through critically, who's going to get grandma sick? You know, they told us to get the COVID shot, for example, to protect grandma. Well, it is sick people who get other people sick. And kids who are unvaccinated are incredibly healthy. They're almost never sick. When they are sick, they get over it quickly. So they are not the threat. It is the highly vaccinated who are constantly sick who are a bigger threat. Anyway, that's sort of the background of a little bit of how I got into this space. And there's a real important reason that I was in a unique position to see this, because you started off by saying, you know, I think the pediatricians are the worst at seeing this, at being critical thinkers. And they are. I mean, I just was dumbfounded that my peers weren't even curious. Like, why wouldn't you be curious? And you're absolutely right. The financial piece was a big part of it. Should I explain quickly how we make money as pediatricians?
Yes.
Okay.
I know this, but the audience may not.
Okay. There are multiple ways in which you are compensated for doing vaccines. I published a paper, this one was not retracted, that showed that I was losing over $1 million a year in my practice. And at the time I was billing about 3 million. Well, if you lose 33% of your income, you don't stay in practice as a pediatrician, because our overhead in pediatric runs 70, 80, 90%. So it's no wonder I made 13,000 that year. That, you know, as my practice was being targeted, you know, it was not a money-making venture. So we make money on what's called an admin fee. And normally you go into a pediatric office and the nurse will give you this little glossy one sheet of paper. It's called a VIS, vaccine information sheet. Here's the information you need to know about the shots we're going to do today for Johnny or Anna. And they walk out and you're supposed to look at it. And then they come in and give the shots. That is their form of informed consent. That is their extent of education on vaccines. And for that, they get compensated handsomely with an admin fee. That for a 2 month, 4 month, 6 month, 12-month visit, it's over $200, probably over $300. Thank you for giving these shots. That's one source of income, which in my own practice would have amounted, based on just the volume I had, would have amounted to over $500,000 just for admin fee. Then, of course, there's a slight markup. We buy vaccines in bulk at wholesale and we sell them at retail. It's not a huge markup, but it's money. It's real money. Then there's some other really sneaky ways we get compensated. Some insurance companies have bonuses. The famous one is Blue Cross Blue Shield, where you could make thousands of dollars by having your kids fully vaccinated. Several of the big insurers do this. But the really tough part that I think really forces pediatricians' hands are other bonuses and other disincentives. So for example, because my vaccine rate for my population, they would look at commonly what percentage of your 2-year-olds are fully vaccinated. Well, hepatitis B for newborns is an absolute ridiculous idea. The moms, we already know they don't have hepatitis B. That vaccine has way too much aluminum, 20, 25 times the safe dose for kids. So none of my patients were doing Hep B. I didn't have any Hep B positive moms. So automatically I get a 0 on my score for what percentage of my 2-year-olds are fully vaccinated. And if you remember your GPA from school, you add an F to a bunch of A's and you still end up with you're a D. I was one of the bad doctors, right? Poor quality because I failed the quality measure. There are 2 ways you get hurt by that. You get dropped by certain insurances, which I was dropped by 2 different insurances just on that issue. But you can also lose money on all your coding in the office. So even when you see an ear infection, you get a compensation based on the IRB code that's used, or ICD code rather, and they can take off a percentage. So in total, it is a ton of money. And you are absolutely right. Pediatricians would not survive without the income from vaccines. And childcare. I mean, that's half your visits in an office are childcare. There's a nice fee for that. And then there's the vaccine money on top of it. You couldn't survive.
So I have to interrupt for a second. I did not know all of what you just said. I don't think the world generally knows about the admin fee. I always kind of wondered, because it actually didn't seem like enough from just the insurance bonuses, as large as they are.
Yeah.
That is a missing piece. That is incredible.
The admin fee is the biggest piece of it. And it's basically a thank you for giving your vaccines. Thank you for educating the people. And the crazy thing, Dr. Gold, is I would walk into a visit and do true informed consent. Here are the risks that I am aware of. Here are the potential benefits, which in many cases are 0 or close to 0. And basically, as a business, medicine is a business. I mean, I owned my own practice. I was talking people, I wasn't talking them out of it, but by educating them the way I was, properly educating these patients, they would choose not to vaccinate. I just walked in, spent 15, 20 minutes, whereas the other doctor spent 5 seconds handing a piece of paper. And I was now losing all that money that you needed to sustain the practice. It was a horrible business model.
Are you aware? I have a question for you. Are you aware of for example, Hep B, or MMR? So they're paying essentially $200 to give the fake informed consent. Just here, sign this. How much are they getting paid? I mean, that's a lot of money. For example, who's paying the $200? Are you saying the insurance company would pay the $200?
Yes.
The insurance company. That's fascinating.
And the insurance companies just up how much they charge the consumer.
Client, right?
And I always wondered, even when we had a big push for HMOs, right? So this sort of we were going to keep costs down. Take Kaiser as a perfect example. I mean, it would seem to me they would make a fortune if they really looked at the data, stopped vaccinating for the most part or entirely, and they would save all that money they're spending on vaccines. They would save a ton of money because their patients would be healthier. It would be it's a no-brainer, like gold mine. But there are other incentives built in. So Kaiser gets money for being involved with vaccine research. Bigger system. The people who run these big organizations, the CEOs and the people at the top, they get a percentage. So if the cost for your insurance population goes up, your income goes up. So there's an incentive at the top to spend money.
You know what's interesting though? I also wonder if it's because society has changed, we've become more immediate gratification, and I'll explain what I mean in a minute. And because the kinds of people who are in medicine have changed. Because I remember a long time ago, correct me if I'm wrong, my recollection is that tonsillitis or tonsillectomies were eliminated because of Kaiser research. So Kaiser looked at tonsillectomies probably because they were interested financially, like, is this a worthwhile use of our money? They actually discovered tonsillectomies really didn't do anything in the aggregate, and they got rid of it, but it was led by Kaiser. And I think this was in the 70s. And so Kaiser at that time understood it was in its self-interest to investigate if something made sense or not. But now you're saying there's financial incentives that maybe stop Kaiser, a large company that would otherwise maybe do better financially if they stopped this, but also they would have to look at their long-term gain as opposed to the current CEO looking at his own checkbook that year, right?
Yeah.
You have to care about the long-term welfare of the organization.
I think you're absolutely right. And they're getting enough incentives, government money and probably non-government money that's coming in to support the vaccine programs, that it just economically makes sense to continue them for them. But it doesn't make sense otherwise. Now, I want to point something out to your audience, because even my mom, I remember I was trying to talk to her about COVID and please don't get this jab, and I could not convince her, because she's sitting there in a retirement community watching the news every day. The sky is falling and COVID's going to kill everybody. And so she went and got this. And her response to me was, well, Paul, how can you be right and all the other doctors are wrong, right? I'm sure you've gotten this, right? So let me explain to the audience why I think I can be right and so many of my pediatrician peers have it wrong. Here's what happened. I started listening to patients. This was back in the 1990s, but for sure by 2000, I was aware we had a problem with vaccines. I'd heard too many stories. By the end, I'd heard hundreds and hundreds of stories of families that were kicked out by other pediatric practices because they wouldn't follow the CDC schedule. And they had nowhere to go, but they had heard, oh, Dr. Paul, integrative pediatrics, they'll allow you to do whatever you want to do with vaccines. So they come to me. And this started happening at a greater and greater pace, to where I was getting 4, 5, 6 new families per week with the same story, Dr. Gold. They had a normal kid, got their vaccines, regressed into autism. They didn't want to vaccinate the rest of the kids. They were kicked out. And so I was uniquely put in this place where I had this large population of unvaccinated. I had an even larger population of partially vaccinated people who were following what I called the vaccine-friendly plan, or less, some other slower way. And then I had a big enough population of fully vaccinated kids that I got to see the difference. Most pediatricians never see it. So they've got their blinders on. They read only material that comes from their own academy and from the mainstream journals that are captured. So they actually don't know, but they don't want to know. I think in their gut and their intuition, they've got to know. And more are now coming out since COVID, because that was just so ridiculous. Even people who didn't want to know had to start opening their eyes. But that's why I was uniquely positioned to really understand this.
I completely concur with you. That's exactly what I had. You were in a position to actually see. But the interesting thing, and you may have discounted it, is you actually paid attention to what you were seeing. There are other people who were able to see, maybe not on the vaccines, but on COVID, for example, and they would not believe their own eyes. Reminded me of that old joke, the wife walks in on her husband who's having an affair, and he says to her, "Who are you going to believe, me or your lying eyes?" I mean, there were so many doctors like that. All of a sudden I had doctors telling me that hydroxychloroquine wasn't safe. I'm like, what do you mean hydroxychloroquine isn't safe? It's been FDA approved for like 70 years. Are you joking? Like, what are you talking about? So yes, you were uniquely situated, but a lot of doctors there were some doctors who did have the evidence put in front of them, but couldn't see it for multiple reasons. I just want the audience to know, like, I don't think most of these doctors are evil. I think they're just, like you said, have blinders on and can't see what they can't see. And was it Rosa Parks who said, when you know better, you do better. When you know better, you do better. I mean, I've certainly given a lot of vaccines in my life. I'm curious because I just, on behalf of the audience, I have not investigated all vaccines. In your book, do you talk about all vaccines? Have you looked into all vaccines? Because that is a resource that I want to make sure everybody reads your book and sees it, because that is a question I get asked all the time.
Yes.
I often say, the COVID shot, they were not vaccines by any classic definition of the word vaccine. But then they asked me MMR, and they asked me about hepatitis, and they asked me about pneumovax, and et cetera, et cetera. So I'd love to hear your opinion on others.
Yes. So I just published a new book, Vax Facts: What to Consider Before Choosing to Vaccinate. This was the book that I really wanted to write. This is the culmination of my whole life's journey. Because when I wrote the Vaccine Friendly Plan in 2016, I didn't have the full picture. We didn't have all the studies we now have that compare vaccinated to unvaccinated. So we now have so much more information. But I start off by covering the philosophy and how it's changed and why it's changed. And then I go into what you do in pregnancy and even before pregnancy, and then infants, all the way to, there's a chapter for adults. There's a chapter, and as you go through all those chapters, every single vaccine that's recommended on the childhood schedule is covered in terms of the worrisome ingredients, the pros and cons, what are the risks, what are the potential benefits. And then I have a logical, easy to follow discussion of a common sense approach, given you need to know the prevalence of these diseases as well. I mean, diphtheria is completely gone. Polio is completely gone for all intensive purposes. You don't need that vaccine. And you can always add it later if for whatever reason these things were to come back. They won't, but I mean, you could. So there are things that are being done. Hepatitis B for newborns, another example, on and on. It turns out for every single vaccine, Dr. Gold, on the childhood immunization schedule, you are more likely to die from the vaccine than you are from the disease in every single case. And this is documented. The references are there. That right there, parents, you're listening, you want to protect your child, right? This is your charge in life as a parent: protect, protect, protect. Well, any death is horrifying. And so the news always magnifies the deaths from diseases, and they never talk about the deaths from the vaccines. And so you're only getting half the picture, actually a quarter or less of the picture, because the real story is the vaccines are causing so much more harm. And it's not just the death, as my research showed and other research that I put in this book. It is all the chronic diseases, the ADD, ADHD, asthma, developmental issues, all the allergies, all the autoimmune issues, asthma. I mean, if you think about the amount of suffering that our children are going through, and imagine eliminating 95, 99% of that by not vaccinating, eating healthy, and all the things that you teach and educate people on, we can have a really different world and a much healthier world.
I want to share just two little anecdotal things that had happened to me. So in 2020, I was introduced to Bobby Kennedy. We did become fairly friendly, but he was the one who turned my thought process around. He said, what if they're selling the vaccines not to just sell the vaccines, but sell all the other drugs that treat all the side effects of this? And that just kind of turned me around. And I am not in a position to know what all the motives are of all these things, but I want people to at least think about that in conjunction with my next little personal anecdote. I have two sons, and one year I was camp doctor, one of my sons at the summer camp. And of course, I went to summer camp when I was young, because on the East Coast, that's what you did. Parents tried to pawn you off for a few weeks. So I was camp doctor, and 1/3 of the children were on medications. It was ADHD, asthma, and usually like antidepressant on the psychotropic kind of category. I was floored. And so, and to some extent, it's what made me think of what you said you were in a position to see. So I was in a position to see, but the other doctors who worked as camp doctor did not see what I saw. One of them was a pediatrician. And I said, this is unbelievable. You're saying 1/3 of the children are on meds? I couldn't believe it. This was just a random sampling of America. And I think back to, my childhood, nobody, I don't think I knew any children who took any meds.
Likewise.
I just, everyone was kind of normal weight. And by the way, the weight thing and all that, there's a lot of factors in that. It's not just that. But I mean, asthma wasn't as common as it was now. Eczema, like you said, certainly psychiatric medications, unheard of.
Unheard of.
Yeah.
So this is what pediatricians today would call, that's normal. So if you're a young pediatrician coming out of training, you have no perspective like Dr. Gold and I have as far as what it used to be like. What health used to look like. You're too young. You haven't seen that. What you see is normal. So it is normal for kids to get all these vaccines. It is normal for them to have severe reactions, but you don't recognize them as reactions because it's normal for kids to get high fevers and seizures. And it's normal for kids, 1 in 6 children to have ADHD and 1 in 5 children to have some developmental problem or neurodevelopmental or psychiatric condition. These are all normal. Asthma, 1 in 10 or 1 in 12. It's normal. No, it's not. That is not how we're supposed to be, and it's not how we need to be.
Right. And that's why doctors of a certain age, I think, were very relevant. One of the things I noticed when I started organizing America's Frontline Doctors was there was the bell curve of the age of the doctors that came to us was quite narrow, actually. It tended to be doctors around age 50, which was 20 years, 25 years after they completed training. But in other words, we didn't have young doctors. And I think the older doctors, we had doctors like that were 50 to 60, and then we had some old timers. That was like generally who came to us. And I didn't have any prejudice towards any doctors. That's also when I discovered that we had 2 pediatricians who came to us in the whole country, 2. There were orthopedists, there were ophthalmologists. Of course, they have private income. Pediatricians didn't have private income, so that was part of it. But also the age was different. Young doctors they believe this is normal. There's an expression, I don't know who invented water, but it wasn't a fish, right? Because to a fish, the water's all around it. It can't even see it. It can't even see the water. So that's amazing. So we'll say it again at the end, but can you tell people how to find your book, Facts?
Yes, it is everywhere books are sold, all bookstores. It is also at vaxfaxbook.com. On that website, you can buy an author's copy. We will personalize a message in it for you if you like. But everywhere books are sold. I want people to understand SIDS is something I'd like us to chat about briefly. You mentioned we would talk about it. I don't know if we have time.
Yes.
SIDS is when you have a healthy baby under a year of age, so 12 months or younger, who you put to bed typically, or you put down for a nap, and you come back in the morning or after their nap, and they're cold, blue, and dead. They were healthy, and they just died. Now, with COVID happening, some of you have heard died suddenly, right? And these adults just dropping dead, which, yes, it had been reported, but nothing like what we saw with COVID. Well, this has been going on in children, but only since vaccine were introduced to children's lives. There was no SIDS back in the 50s, 60s, and even I think it started in the 70s where they came up with that term. It's very interesting to note something. The coroners, so if an infant like that dies, you would think you get an autopsy. So you've got to figure it out. Why would a kid just die? The coroners since 1979 have had no code for died after a vaccine, death by vaccine, anything. It was eliminated. So they have to come up with other labels. Doctors provide labels to justify their existence and being paid. We have to find something. So SIDS was developed, sudden infant death syndrome. Sudden unexplained infant death is another category. Suffocation is another category. Died of unknown causes is another category. Here's the thing, Dr. Gold. In the United States today, in the last few years, we lose about 20,000 infants die every year. We have one of the highest infant mortalities in the world for industrialized countries, almost the worst. We also have one of the most aggressive vaccine schedules. That could be coincidence, but I'm going to show you why it's not. And in my book, the chapter on SIDS goes through this in detail. A very well done article by Neil Miller looked at the 6 best studies that actually showed when babies died relative to when they got their vaccines. And when you combine the data from all 6 studies, 78%, most babies died in the first week after vaccines. In fact, most of them were on day 2. Day 1 and 2 were the worst, but 78% of these babies are dying after the vaccine, very close to the vaccine. None of them are dying the week before a vaccine. So, I mean, you and I were trained, if you give penicillin, you get a bad rash, it's a penicillin rash. Well, today we have enough data, multiple studies. If you give a vaccine and the baby died, the vaccine killed that baby. And we have data that SIDS is responsible for over 2,000 of those 20,000. But guess what? The ones who are labeled sudden unexplained death, the ones that are labeled suffocation, the other ones that are unknown, you add that all up, you're up to 7,000 or 8,000 babies dying, probably mostly from the vaccines. This is a tragedy that could be stopped like that. And we know the mechanisms. Association doesn't mean causation, right? That's always we're told that. And yes, we know that, but association could be causation. That's how we start to understand disease mechanisms. And in the case of the harm caused by vaccines, you've got to start looking. Then you figure out, okay, is it reproducible? Yes. Multiple studies showing the same thing. Do we have a plausible mechanism? Absolutely. Vaccines are causing immune activation, direct toxicity. They're triggering massive inflammation and changes in the brain and autoimmunity in the brain. It's shutting down the respiratory center. It's clear. We have the mechanisms. We have the data. It's time to stop the madness.
Wow. That was incredible. I'm going to share that far and wide. We had different specialties. So I was an emergency physician. So I was sometimes on the receiving end of a SIDS baby with frantic family. And I don't know if you remember, but I'm also a lawyer. And I'll tell you, there's so many aspects of it that were horrific. A death certificate, for example, is a legal finding, a legal document, for example. And there were often the families, there was this haze of suspicion over the family, be like, oh, maybe the mother is secretly abusing the child, right? There was a lot of that.
Yeah.
There was talk about, mothers being smokers. I mean, there was all kinds of like innuendo around it. And I can't believe that we would never ask about the vaccine schedule. It wasn't just babies, but adults too. Never, never, never ask. And when you say that so many of the deaths were within the first few days, I mean, we called everything remotely related to penicillin med a penicillin reaction. In fact, we called so many things penicillin reaction that I was the doctor that would give penicillin in the ER because I said, I'm going to prove right now that you're not allergic to penicillin. I was so tired of hearing this for years. And all the times I would give there's a 10% cephalosporin in penicillin, right? So I would give them Mircefin just to test it out. In my entire career, I never had a problem from a person who said they had some vague penicillin reaction, right? So we doctors in other areas have not been afraid to look at causation, but we're literally refusing to look. And that to me is damning. That to me is highly suspicious.
Yes. The elephant in the room is the vaccines. They are triggering most cases of autism. They are triggering most cases of SIDS. Not all. You will always find exceptions because we live in such a toxic world. The problem with our vaccines, I'm not against vaccines. I'm pro-health. And if we would have a properly designed vaccine that didn't have a lot of toxins in it, that was tested against a saline placebo.
That's my question for you. So our audience pretty much knows that they're not two balanced kind of studies, but is it your belief, because you said you're not anti-vaccine, your belief is it's the additives?
Absolutely. So it's what's in the vaccines that is triggering the problem. And we're not testing these vaccines for more than sometimes a few days in the case of hepatitis B, but they're never tested against a proper placebo, which would be a saline shot. They're always tested against another vaccine, oftentimes more dangerous, or the adjuvants that are in the vaccine. So we know aluminum is really problematic for triggering autoimmunity and toxicity and problems. So a lot of the studies will include the arm that's supposed to be the control group has aluminum or another vaccine. And you can go to a package insert, and I've done this, and it's available in my book, VaxFacts, for every single vaccine, and you can look up the percentage of serious adverse events. Now, here's one of the tricks of the trade, if you will. I looked up Prevnar 20. So pneumococcal infections can affect the very young and the very old. And they've come out with a new one. It covers 20 strains of the about 100 or so pneumococcal strains out there. So I'm thinking, okay, it's new, it's improved, it's better. Let's see, what did they use as their placebo? Well, they used the Prevnar 13. Okay, so they used a dangerous vaccine as far as some known side effects. Let's go look at those two arms of the study and what did they find? Dr. Gold, in the two arms of the study, there was 1 in 20, 5% of both arms had serious adverse events. Serious adverse events include death, include SIDS, those sorts of things. Who in their right mind would take a 1 in 20 chance of a serious adverse event with either of those vaccines? But guess what? Because they were the same, the company that makes the vaccine and then all the writings about it that go out after that say that it's safe because there's no difference. I mean, in the case of Gardasil HPV, there was an arm of the control group that was 10% serious adverse events. 1 in 10 chance you're going to harm your child for a vaccine that actually we don't even know if it's making any difference because you have to wait decades to see whether cervical cancer develops. So it's all smoke and mirrors. It's shoddy, what we call tobacco research. It's a mess. But maybe with RFK Jr. at HHS, he's saying we're going to start demanding proper placebo-controlled trials, and we're not going to approve vaccines unless they go through that process. That would be amazing. And this is why I'm not anti-vaccine. If we could have first of all, you need to have a dangerous disease. Why would you vaccinate a healthy person against a disease that's not dangerous? And most of the diseases on the childhood schedule today, those diseases aren't dangerous anymore. So we should be dropping all those anyway. But if we had a truly dangerous disease and you could develop a vaccine that was truly incredible at preventing that disease and it was safe because it was properly tested, we'll all line up. You won't have to coerce us. We'll be lining up for it.
I love it. So let's close out with just your opinion. I'm actually very optimistic that we would get some better research under Secretary Kennedy. He really knows the subject cold. I've had many conversations with him on it. He does know the subject. So I'm optimistic. Just kind of wondering, I imagine you are as well.
Absolutely. I think, unfortunately, this whole issue of child health and health in general has been turned into a partisan issue. It doesn't need to be. I mean, Kennedy was a Democrat from the get-go, but he doesn't care about that. He just cares about health. And so he had to go the route he did because it was the only way he could have a voice. And thank goodness it worked. He's in a position now where he can actually make a difference. And to his credit, he's not rushing in. I mean, he could have gone in there with just like hack job and he's being very careful because he wants to get the data. He is truly a man of science and integrity, and let's get the data. And unfortunately, there are so many roadblocks being put up for him to actually even have access to the data within the organization that he is in charge of. It's incredible what he's having to go through, but I think he will get enough data to really answer the questions well, and hopefully people will start to listen.
Yes. So we are all going to, or at least many of us are going to go read your book. I have not read your book, Facts, and I feel woefully undereducated on the subject. I'm so excited, looking forward. I'm going to order it immediately. That's the truth. I don't say things unless I mean it. Now, that means it will land on my nightstand, and as soon as I can read it, I will. But I'm delighted, and I just want to thank you. And this may sound a little bit, I'm not sure, a little bit corny, I suppose, but I honestly want to thank you on behalf of humanity and on the American people, because the road that you have taken, I know for certain, is pretty thankless and often very punishing. I've been on that road, but your content and expertise that you've contributed is invaluable. I mean, to have had a practice where you had unvaccinated, partially vaccinated, and fully vaccinated children, and to have absorbed that data, written it up, done all that is incredibly important. I'm a mom, right? So mom, American citizen, warrior doctor. I just want to thank you because you probably got very few thanks along the way. So,
well, thank you also, Dr. Gold, because it is warriors like yourself, and you actually went to jail for what you did. So I'm so sorry that happened to you, but you stood firm in your beliefs. And as a doctor and attorney, you added, a whole lot of value and clout to the message that you're trying to share. And so I thank you for that as well. And for families out there who are listening and you're going, well, we can't do what they're doing. Oh, yes, you can. I have a really hard time going up, and I know all that I know. I have a really hard time going up to my peer pediatricians who just look down their nose at me like I'm some kind of an idiot and having a debate with them because they just throw nonsense at me. Well, you parents who are watching, or even if you're not a parent, and you gather the information that we've been talking about here, you read Facts, and you listen to this show, the Gold Report, you know things that other people need to know. And the courage of just going to another fellow pregnant mom and talking to her about vaccines, for example. Had you thought, just ask them questions. Have you thought about this? Oh, I was listening to the Gold Report. I was reading VaxFacts and I learned this. What do you think? That takes courage. And that's how we're going to change the world. It's all of us linking arms together.
Listen, I don't have anything to add to that. That's kind of what I usually say at the end of all of my shows. I said, you go up to whoever, and your boss, your mother-in-law, and you don't have to get into fights with people, but you go up to everybody and you share your information. The problem with censorship is that at least it's self-censorship, right? The cancel culture has led people to censor themselves. So VaxFacts is absolutely on my must-read list. I have that responsibility to the world because a lot of people ask me these questions, and I'm delighted to have had you. Please go find VaxFacts wherever books are sold. And I want to thank you, Dr. Paul Thomas, for being a reasonable pediatrician who thought for himself and observed the world around him and decided to do something about it. Thank you.
Thank you, Dr. Gold. I will just add one little thing. There's a little secret ingredient in VaxFacts, and that is my co-author, Dee Dee Hoover, who is called Just a Mom. She is a mom, and she likes being just a mom. She's not just a mom. She's a powerhouse. But she writes a little notes section at the end of each chapter that sometimes the science can get a little heavy or it can be a little distressing, and then you've just got a mom's perspective. It's like, boom. So I've had, especially the doctors who read this book, they just go to her part because they know what I'm talking about. What does Dee have to say?
That's brilliant that you did that.
Yeah, and we also coach families at kidsfirstforever.com, the number 4. So that if you have, especially I do mostly vaccine education in my coaching, but Dee Dee Hoover can coach on almost anything. So she's a very gifted, intuitive person.
Excellent. Thank you so much for sharing your time with us, Dr. Paul Thomas. Fantastic. VaxFacts. Thank you.
Thank you, Dr. Gold.
Thanks for joining me on the Gold Report, where we inspire you to be 10% more courageous. Remember to like, share, and subscribe. We'll see you next week.